Imagine, you're the parent in a lower middle class family, just struggling to get by, barely paying bills. And then out of nowhere, your child was diagnosed with a life-threatening illness and needs immediate surgery in order to live on. Unfortunately, you cannot afford the operation and are left only to pray for your son. Slowly, you watch him die. A universal healthcare system is the solution to America's healthcare issues. Now, you may or may not have health insurance, but regardless of your situation, it would be improved if we implemented such a system. Today, I'll be discussing many of the issues Americans face when it comes to healthcare, and I'll propose 3 solutions to these problems. I'll begin by discussing how hard it is for some people to have access to adequate healthcare. First and foremost, too many Americans do not have health insurance. According to healthcareproblems.org, last updated on November 7th, an estimated 85 million Americans are without health insurance. This causes the potential issue of not being able to afford medicine or an operation when it's needed. Furthermore, the system is of low quality and it's too expensive. According to an article written on Forbes last June by Dan Monroe, actually, America has the most expensive healthcare system in the world. The same source goes on to suggest that it's of low quality as well. And healthcare premium spending represents 16% of our nation's GDP. Now, you may be asking, how is it of low quality? Well, according to an article in the Washington Post written by Lenny Bernstein on June 16th of last year, while the U.S. does score highly on patient-centered care and preventative measures, it scores poorly in everything else. And this includes equity, access to healthcare, and healthy living. Which brings me to my last point. Americans generally are unhealthy. That's right. According to an article written by Tahereh Hajjat in the Review of Business and Finance Studies, last updated on November 19th, actually $75 billion are spent annually treating such complications such as obesity. The article then goes on to cite several causes of obesity, most of which consist of personal choices. It's important to note that it would not be fair for society to bear costs that are caused by poor choices. So why then do Americans spend so much money for an ineffective healthcare system? I'm not too sure, but the current system needs to be overhauled, even with the Affordable Care Act in place. As I already said, a universal healthcare system is the optimal solution. In this proposed system, taxpayers will pay an affordable tax rate, but in effect, there will be little to no out-of-pocket costs for healthcare. Most other industrialized nations follow such a scheme, most notably Sweden, which may be why they rank higher than us when it comes to healthcare. According to Sweden.se, last accessed on November 17th of last year, actually the Swedes are predicted to keep living longer as they are already living longer. Even the developing BRIC countries are adopting similar schemes. Brazil, for instance, has its unified health system in which each level of government sets aside a specific budget for healthcare. Russia, for instance, makes health insurance mandatory in some instances, and it's included in payroll taxation. If the U.S. were to adopt a system similar to any of these, most of our issues would be resolved. In short, yes, taxes will go up, and no one likes to hear that, but in effect, our healthcare spending will be more efficiently allocated. Now, in addition to such a governmental solution, there are things we can do at the individual level. Communities, for instance, should enact healthy living campaigns. According to an article appearing in the Pharmacoeconomics Journal, written by David R. Raponge on November 9th, while long-term care spending will increase due to the unhealthy people now becoming healthier and living longer, it goes on to note that the short-term savings will outweigh these costs. Therefore, it is worth every single ounce of effort to do our best to calm down such epidemics such as obesity. We should educate each other on healthy living, exercise, and the importance of it. Furthermore, perhaps the most effective thing we can do to solve our healthcare issues is to simply not give in to high healthcare costs. That's right, the best thing we could do is just to fight back. So how would we do this? Well, one way we can do this is what we're doing already, use generic drugs. According to an article appearing in Business Source Premier written by Catherine Eben on January 13th of 2013, actually, we saved $193 billion in the year of 2012 because 80% of prescribed medicine was actually generic. Now imagine if everyone was convinced that generic drugs are just as effective, we'd be golden. Furthermore, people are encouraged to see salaried physicians instead of those who paid by service. According to an article written by Jeff Levin Skirts, last accessed on November 19th of last year, salaried physicians actually perform less operations, And you could probably guess why. It's because they have no incentive to perform unnecessary operations. But above all, people, in particular the old, should take daily preventative measures to avoid unnecessary doctor visits in the future. According to the recently mentioned source, 1 in 5 Medicare patients discharged from a hospital will be back within later that month. This could have been avoided if they had just followed procedures, followed up, scheduling follow-up appointments, and taken their medicine when they were supposed to. Perhaps a slightly higher initial investment will save money in the long run. So in summary, yes, America's healthcare system does have its flaws. However, they can be fixed. I told you about many of the issues we face, but then I did provide 3 reasonable solutions to these problems. Free healthcare is the common sense approach to the issue of people not having access and not being able to afford healthcare. Innovations are meant to be shared upon everyone, and not just those who can afford it. Even disadvantaged babies born into poverty